Now I'd like to welcome Samir Savarkar from Neurosynaptic. He's in the healthcare field.
Good morning, friends. Am I audible?
Yes.
Good morning, friends. I'm Samir, founder of Neurosynaptic Communications. We work in the healthcare field, healthcare delivery, especially to the rural areas. Neurosynaptic was set up with a mission to enable access to quality and affordable healthcare to the rural areas about 10 years ago. It was Rajiv and I, both alumni of Indian Institute of Science, who started this. The need is very well known. There is about 70% of the population of India which lives in the rural areas and lacks access to a very basic, even primary health care. And that is the problem we set out to address. This has been quite a journey. We started with an understanding of the problem which we thought initially was primarily a technology-based problem. We built a great solution called Remedy, Remote Medical Diagnostics. This is a platform which comprises of certain hardware which measures physiological signals like the ECG, blood pressure, temperature, heart and lung sounds, and so on. Basically, completely indigenized technology to reduce costs, make it affordable. We put together technologies with very low bandwidth communication, amazingly low bandwidth communication for audio, video, and real-time medical data transfer as low as 32 kilobits per second so that it can work on the normal telephone lines. And then the journey began in 2005 really when we realized that putting together a technology solution is not enough. And we really set out from 2005 to 2007 in search of various kinds of business models that would work, various kinds of economic models, employment models, training models, and so on. And eventually started scaling the models, a few of the models that we realized were working well, especially with NGOs, with the hospital outreach, and with the government. And today we I'm proud to say that today we have the largest rural e-healthcare enabled network to our credit, with more than 677 village e-healthcare centers, more than 3,000 ANMs carrying these mobile solutions into the field with door-to-door for various things like the awareness creation, the data collection, and the consultations at the back end. There are 4 central medical facilities from where these doctors continuously provide consultations daily, hundreds of them, to each of these village centers, which are located in the poorest states, mostly in the Bihar, UP, 14 districts of Bihar, 3 districts of UP, totally 28 districts in the whole country, and have served more than 200,000 paid consultations in the last 2 years alone. This with the 75% of the need of people being satisfied at their village level itself, which means they do not have to travel further than their village to access their healthcare needs. And that too at a nominal cost of $1 to $2 at most, and $2 when they choose some aspects of the services, saving thereby $6 to $8 of costs which otherwise would have been incurred. Now this is not only between a patient and the doctor, but the solution really acts at an integral level where you have diagnostic centers in the nearby region per 5 villages or per 5 centers linked to it. You have various nursing homes or clinics which are also integrated onto the system, providing physical consultations when they are necessary. And there are hundreds of pharmacies which are also replenished with medicine with the help of the IT giving input on what medicine is needed where, and has been seamlessly functioning since the last 5 years, 2008 when we started scaling. Started with 5 centers in 2008, 30 in 2009, 128 in 2010, and today we have in Bihar alone about 430 centers out of these. So the future plans, of course, are very interesting. We have certain technology that we want to enhance at the point of care by putting biochemistry tests, etc., which can be executed at the village level. There are, of course, limitations. And we search for right partners also for the point of care solutions, and right partners for increasing the implementation scope. We aspire to reach to or become the preferred partners or preferred access points for 25% of the rural population in the coming 5 years. Thank you so much for this opportunity for presenting our work.